Hello everyone, how are we doing today? Just wanted to continue to talk on AVN, avascular necrosis. Now, let's go ahead and jump into what avascular necrosis really is. It's basically, again, the lack of blood going to a certain part of the body that will cause the tissue or bone to also die. I touched upon this in the other group yesterday about with AVN, how prevalent it is in sickle cell patients. But it can also happen to other individuals. Diabetes, we see some of this stuff happen to toes, knees, hips, and which can cause gangrene, things of that sort. We also see it in some hypertensive patients, but that's very, very rare. But let me go ahead and jump into AVN and the possible things you can do to also prevent AVN, or if you're in pain for AVN, how you can reduce the pain levels as well. I'm going to discuss taking things orally and also putting plasters on. And I'll run you through a few plasters as well. Let's go ahead and discuss the reason why AVN even occurs. Like I say, avascular means no blood. So what we want to do is really create a source of blood going to certain areas. And one way to do that, I'm going to talk about plasters first and foremost, is different peppers. Is something in peppers called capsaicin. This way actually makes it hot. And we've seen that if you also apply this to the skin, if you have different carrier oils along with it, it can actually, again, bring heat to the area. Heat basically means that it's actually bringing more blood to the area, thus creating a lot of vascularity in the area as well. So I tell individuals that have any sort of pain from vascularity, or start having any sort of joint pain, so you want to start to have these different plasters. You can do a ginger. Turmeric, vinegar, and coconut oil. Mix that all together. And if you want to throw a little baking soda in there as making it a little pasty, the baking soda will actually help it bind a little bit better to the skin. You can actually start to put that on your shoulders, your hips, your knees, and different areas of pain. What is it going to do? Again, like I said, it's going to bring some blood to the area, but it also is shown to also reduce the pain and also inflammation. So by reducing the inflammation, it's going to actually start to also alleviate pain as well. So this is something that you guys definitely want to try. I did mention the capsaicin or the actual peppers. I want you to be very, very careful dealing with peppers, because peppers can really burn the skin. That's why I say you want to make sure you use it instead of a different carrier oil. But you can use not a chopped up pepper. You can actually get the essential oil as well and mix that along with that, especially if you're in advanced stages of avascularity or AVN. You can also start to use that in all the areas that you even feel some sort of pain. Another thing you can do is you can actually start, and this is kind of weird, but what you can do is do the same thing. You can grate a little bit of ginger, grate, like, I mean, when I say like a few slithers of a piece of cayenne pepper, and then mix that with an egg white and a little bit of vinegar as well. And they can use that as a plaster too, that you can actually wrap your knees or wrap your shoulder up, or wrap your, just put it somewhere where you can actually sleep with it overnight, and of course wash it off in the morning. The egg yolk is actually going to allow things to soak into the body a lot faster, but it's also going to stay in place once it dries too. So that's why we try to use that. These are some old school remedies that I'm throwing at you right now, but it definitely work. It was a research. I mean, it's been a lot of research done with avascular or AVN here in the States with natural remedies, but also it's been all over the world, because again, AVN, like I say, is not just a sickle cell thing. It does happen in other diseases as well, like I said, with diabetes and some other conditions as well. So you got to be very, very careful. Notice, so with diabetes, they have that neuropathy. Their neuropathy unchecked can actually turn into avascularity, because again, if you're not for sure where the blood is going or where the nerves are going, the blood supply will start to slack in those areas. That's why people tend to have things amputated as well. You can use that for a diabetic patient too. So then orally you want to do, there's a bunch of herbs you can definitely take. One reason why, and yes, I'm talking about even flow now, because I'm telling you the reason why it was created. The microcirculation that is being created by the Dong Shuiyang. I'm sorry, I'm saying some Chinese things. I do speak some Mandarin Chinese, so I apologize, but I know a lot of Chinese or Latin terms. But is the Lingerstum and the salvia. The salvia, I'm going to do a little sidebar now. The salvia individuals have this thing. If you look online and you put it in salvia, people are smoking salvia and things like that. So that's not the salvia we use here. Salvia, the salvia that we use does not create any sort of hallucinogens. There's nothing toxic about this salvia at all. It's a completely different strand of salvia. It's just like saying one rose bush is the same as all rose bushes, and we already know that you can get a rose bush that has long stem roses, short stem roses, and they're all different types of species. So the salvia we're talking about is a medicinal one that's been studied for at least 5,000 years. And again, like I said, I read a text about salvia itself that was at least a foot high. So I know for certain, and the research shows that the salvia that other individuals are abusing is not the salvia. So I just want to say that sidebar. But salvia has been shown to actually create microcirculation in women around the uterus areas and also in the pelvic floor. And also in men, it's sort of the same thing. So it helps with prostate issues, but also pelvic floor. When I say pelvic floor, you got to understand that where the hip joint attaches is in that pelvic floor region. So if we're able to get more microcirculation into that area, that means what? We're going to be able to prevent a lot more of the AVNs happening in the hips as well. So you got to be very, very careful about stuff like that. Once again, I'll say ginger. You know, you can definitely have a lot of ginger tea. Ginger, if you notice that when you drink ginger, it actually warms you up. You're like, man, it's a little spicy. That spice is actually creating, again, microcirculation inside the body. Even if different vitamins. One vitamin that I do like, but it causes a rush, is niacin. Niacin causes that rush inside the body, but that rush, again, is opening up those microcirculation, the microcapillaries inside the body that's allowing more blood circulation throughout your entire body. You got to think about these things. Magnesium, vitamin D, and calcium are very, very good supplements to also be taken as well. Ginseng is something that has been abused a lot in this society because of the fact that it gives you energy. But again, the only thing that ginseng does is actually increase your circulation or increase ATP, which is energy packs inside your body as well. But again, it's going to create microcirculation and also allow the muscle to contract a lot more readily as well. The other one I want you to focus in on, I mentioned turmeric inside of the plaster. You can definitely do that, but you can also take turmeric internally as well. This, again, will also help the inflammation that's created with the pain from the AVN in the shoulder, in the back, or inside your vertebral column as well. So all these things you want to really look at. As I said before, you know, a lot of this stuff, and I think that the research I said it's about 73% of individuals that have AVN in sickle cell population, it really was the fact that they were micronutrient deficient, which means that they were lacking their zinc, their vitamin D, their calcium, their magnesium, their B vitamins. They were deficient in all these things. So again, if the body is deficient, not to have the proper nutrition, what's going to happen? It's going to start pulling all of the nutrients out of your bones as well. So you got to be very, very careful. Make sure that you're taking your vitamins, you're taking the proper herbs. And again, if you have any questions, guys, please always feel free to ask these questions below. Or if you want to share this information, if you want to be more engaged with us, this is the reason why we do this stuff. We've had questions about AVN before. I didn't do a lot of videos on it before, only because of the fact that I was trying to deal with just having people understand about being healthy. Now I'm trying to go a little bit deeper and really discuss the AVN because it's huge. You know, I mean, I think last week alone, I've had questions from like at least 10 different people concerning the AVN and possibly having surgery and things of that sort. You know, they're stage 1 to stage 4 AVN cases, and those cases, you know, from the research I've been seeing, stage 1 to stage 3, we can actually slow it down and almost reverse those things because, again, like I said, when the AVNs start to happen, the bones no longer look like a honeycomb inside. It looks like a spider web. The spider webs are very porous and is able to break very, very easily. We can actually reverse that by giving the proper nutrition, by giving the proper nutrients, and have your body start to produce less inflammation as well, and start to produce more osteocyte, which is the cells that actually start to create more bone as well. But again, in stage 4, the worst stage right before you actually have to have the surgery, we can reduce the pain. We can make you feel comfortable as well. But again, we're trying to prolong that because going under the knife, no one wants to go under the knife and actually get a titanium hip or shoulder. Does not feel good, and the process of healing is very, very long as well. In a sickle cell case, we don't want that to happen because of the fact that the possibility of using the pain medication is also possibly going to a crisis, but also with diabetic patients, just the fact that you actually already have some sort of neuropathy or loss of nerve function, you are at risk for other things as well when you go under the knife as well. So again, a lot of this stuff is really about nutrition, and you got to understand that the body works off of proper nutrition. You have that, a lot of these things will start to go to the wayside as well. Like I said before, guys, you know, give me thumbs up, give me hearts, give me things like that, because this is just going to show me that you guys want to be more engaged with us, and we will give you as much information as possible. This week, I've been talking about preventing a crisis. The reason why it's important to prevent a crisis is because of the fact that these AVNs will start to happen, because the scar tissue that's created along with every crisis. You know, I had a young guy about a month or so ago. He was having lung issues because of the fact that his lung capacity was decreased because of the amount of chest crisis that he was having, and the tissues inside of the lung itself was now being damaged because of how many, you know, crises he was having. You must remember, each time you have a crisis, there's some sort of damage that goes on to the tissue, either the artery, the vein, or the micro arterioles that are inside of the body in different areas, or even the muscle tissue may actually start to die itself. And again, that's the precursor for a lot of these AVNs, a lot of these, you know, lung issues and things of that sort. So our goal is to do what? Prevent, so none of this stuff will actually happen as well. And there's a lot of things we can do. And please stay tuned, because we'll keep giving you information on how to keep preventing these things from happening and having you have a better quality of life and a more full quality of life as well. Again, that's why we're doing this stuff here. My name is Dr. Charlie Ware. If you have any questions, I'll be online for another 15-20 minutes. Take care and have a phenomenal evening, guys.